Hello, everybody. We're absolutely delighted to welcome you to the Urgent COVID-19 Mental Health Prevention Summit. We are absolutely delighted to have over 1,000 people registered to this event. Please do use the Q&A function to share your thoughts and ideas. We want this to be an interactive event. Please do use the Q&A you'll find on the right-hand side of your screen, and we will aim to answer as many questions as we can, as well as capturing any feedback that comes from the sessions. You can go onto the SLAM website and find out any guidance or support you need if you're having difficulty being able to access the broadcast today. We will be recording the summit and the breakout sessions, and these will be published on Thursday at www.slam.nhs.uk. We will be explaining very shortly how to join the breakout sessions later in the summit, and please do follow the instructions carefully. We are using technology and we're very grateful for you to have joined us in this way. If something does go wrong with the broadcast, please do not worry. Exit the meeting, put the kettle on and rejoin us in 5 minutes using the same link. My name is Ranjit Kale. I'll be the host of the summit, and my co-host will be Olivia Lurch. We've got a packed agenda, and I'm not going to run through the whole agenda. We've got a series of 4 breakout sessions that you will be able to sign up to at the midpoint of the summit, and we will talk about that very shortly. And we will come back for a plenary where we will talk a little bit about the themes that have emerged from the sessions and also talk about the next steps. Without further ado, I'm now going to hand over to Sir Norman Lamb, Chair of Southland and the Mosley, to be able to kickstart the summit for us.
Well, thank you very much indeed, Ranjit, and thanks also to your team. You've all done an extraordinary job in a short space of time to make this happen today. Thanks also to the tech people. This is a massive experiment, but we're immensely grateful to you for your work. Can I thank also everyone who's been involved in this for clearing diaries to make this possible today. I think it's immensely powerful, but I also particularly wanted to recognise the council leaders of the 4 councils for being so supportive and enthusiastic, and we were very keen that this should be a joint invitation, and it's great to be working with you. And also I wanted to thank Gregor Henderson, who will be talking to us. He's the mental health lead from Public Health England. It's great to have a national voice as part of this discussion. I also wanted to take this opportunity to thank all the frontline workers, not just in healthcare, but also in social care, the bus drivers, the tube workers, everybody who's been involved in keeping things going during this crisis. We salute you for your efforts. We thank you sincerely for what you have done. I also think it's appropriate that we stop for a moment and recognise all those who have lost their lives. Let's remember them and their loved ones. Whatever the reason for the loss of life during this crisis, it has been an additional trauma for everyone involved, and we must remember all of those people. So why are we holding this summit? Well, we all recognise the risks that are out there, the risks to our mental health and our well-being, the isolation, the loneliness, anxieties about finances, the risk of the loss of employment, the fact that so many people will be experiencing bereavement, the fact that we've seen this horrifying increase in domestic violence, the sense that some children will be at increased risk without the sanctuary of school. All of these things together mean that we recognise that there is likely to be a psychological fallout from this COVID crisis. And it seems to me that we need to be working together to meet that need in the most effective way. We know also that there has been a disproportionate impact on BAME communities and a disproportionate impact generally on disadvantaged communities. And so we see disadvantage heaped on disadvantage, and it would be entirely wrong to stand back and do nothing. And this summit, I want this summit to be the start of an action plan to address those disadvantages and to do it in the most effective way through collaboration. So we have a duty to act, it seems to me. We have to confront it. We have to plan now for what is likely to happen, and we have to develop effective responses to support communities. And I think the real power in today is that so many organisations and people have come together. No one organisation could do this on their own. The only effective way, as I have said, is through collaboration. It's remarkable that over 1,000 people have registered today. That suggests that this has struck a chord with people. But this must not be a talking shop. This must be the start of concerted work to make a difference to our communities. We must start serious work over the next 12 months and beyond, if together we can have a positive impact on the communities that we serve, if we can empower people, if we can save just one life, then it must be worth it. And we must also make sure that we recognise that we won't come up with all of the answers today, but it's the start of a process that will lead to answers. And I hope we can agree today the steps that we will take together. We plan monthly broadcasts, each focusing on an emerging theme from the work we do together. And we plan to reconvene in October for another summit, when we will publish an action plan for the remainder of the year. Finally, I also want to take this opportunity to alert you to work that we are embarking on at the South London of Maudsley to develop a clear vision and ambition for our organisation, what we need to do, what we have to achieve for the communities that we serve. I absolutely want this to be an open process. We want your views. We want to learn where we need to do better. Please use the Q&A function today to give your initial thoughts. After the summit, we'll email everyone and we'll also send a survey to get your views both on the prevention work that we're starting today, but also your views on what you think SLAM as an organisation needs to do in terms of setting an ambition, a vision for what we should be doing to support our communities. Thank you very much indeed.
Thank you very much for that, Sir Norman. And I'm going to hand over to Gregor Henderson, who's going to talk about the national issues and role of local leadership in addressing psychological consequences of COVID-19. Tony Newman, leader of Croydon Council, will be joining us later on. So I'm going to hand over to Gregor now. Thank you very much for that, Gregor.
Great, thanks Ranji, and thank you Norman, and thanks very much for the invitation. Ranji, oh no, that's fine, I'm not getting the echo anymore. It's a great pleasure to be here, and it's a great initiative. You know, I feel that it's just so fantastic when four very, very powerful boroughs come together with an NHS provider, another VCS and community interests in South London to talk about prevention. It's a matter that's incredibly dear to my heart for two reasons. One, I've always been an advocate that prevention is undersold and underinvested in, and second, I live in Borough, so I have a local interest in seeing what you do next. Let me try and do two things in the time that I've got with you. The first is to give a little bit of a national picture from some of the data and evidence that we've been tracking and surveying and also investigating at this time. And then secondly, just give some thoughts that I've managed to amass together from a number of colleagues and others across the world on the role of local leadership as you try and look very, very closely at what a local community and integrated response to prevention could look like. But let me first start with giving you some of the headline data that is coming from a weekly tracking and surveillance exercise that we're doing in Public Health England. We are tracking a number of national surveys, we're tracking helpline data, we're tracking digital data, we're looking at some Google Analytics, and we're putting all of that together in a weekly tracker. That tracker we're using to share across government departments and also with NHS England and others, and we are at the moment making that tracker available publicly. So within the next week or so, this tracker will be available publicly. What it's showing is that when lockdown happened, all measures of mental well-being began to go down and spike downwards. And since that time, levels have begun to rise a little bit up, but they are still on all levels below where they were before lockdown. So we're seeing a considerable impact on the population's mental health and well-being. There are groups who are reporting much worse mental health than others. These include young adults, women, people from ethnic minorities, people living alone, people with a lower household income, and people with existing mental and physical health conditions. Older people are reporting slightly lower levels of stress and anxiety and are likely to report less negative impact on their well-being. There's some mixed evidence on key workers, but some of the earlier evidence is showing that there are worse levels of mental health and well-being amongst our key workers. And also there is evidence to suggest that around 25% of adults who would like mental health support have not been able to access that support at this time. And there are a number of people reporting that they are not receiving the same level of service as they did before lockdown. And those with severe and enduring mental illness, as far as we're able to track them on national surveys, are showing that on all levels of mental well-being or indeed overall well-being, their figures are much, much lower than the general population. The other area that PHE has been focusing on, and we've just published a document today on disparities in the risk and outcomes from COVID-19. And this review, which is published this morning, is based on surveillance data that's available to us. So the largest disparity that we found was by age. Among people already diagnosed with COVID-19, people who are 80 or older were 70 times more likely to die than those under 40. Risk of dying amongst those diagnosed with COVID-19 was also higher in men than women, higher in those living in the more deprived areas and those living in the least deprived, and higher in Black, Asian and minority ethnic groups than in white ethnic groups. These inequalities largely replicate the existing inequalities in mortality rates in previous years. We've also found a high increase in all-cause death amongst those born outside the UK and Ireland, those in a range of caring occupations, including social care, nursing auxiliaries and assistants, those who drive passengers in road vehicles for a living, taxi minicab drivers, and those working as security guards and related populations, and those in care homes. We're also seeing London with the highest rates of COVID-19, followed by the Northwest, the Southeast and West Midlands, with the Southwest of England having the lowest rates. And local authorities with the highest diagnoses and death rates are mostly urban, and death rates in London from COVID-19 were more than 3 times higher than in the region with the lowest rates, the Southwest. If I turn to some of the data that we're tracking on community action, slightly more positive news in this arena. Nearly 2/3 of adults say that other local community members would support them if they needed help during the pandemic. That's up from the previous year. 3 in 4 adults, that's 77%, saying they thought people are doing more to help others in their local communities since the pandemic. That's up 10%. Nearly 2 in 3 adults have checked in on neighbours who need help at least once in the last 7 days. And over 1 in 3 adults have gone shopping or done other tasks for neighbours, which is up again 10% from previous figures. If we look at some of the evidence, what we're looking at is evidence reviews from previous pandemics and other crises. And what we find is the biggest impact in relation to social determinants. So when thinking about depression, thinking about mental health, mental distress, mental illness, it's really important that we have an evidence base looking at the risks and the protective factors. I'm going to list these because I think as you're going through the conversations, some of these things on this list will resonate with you. So the greatest risks to community mental well-being are caused by recession, discrimination, crime, violence, abuse and trauma, debt, poverty, financial insecurity, unemployment and inequalities. The protective factors which will mitigate against some of those risk factors are protective social protection policies, supportive educational policies across all ages, access to the natural environment, green space and blue space, voluntary and community service infrastructure, working conditions, good levels of housing and housing standards, access to health and social care, community resilience, good social support systems and social connections, abilities to support good family relationships and parenting. And on individual factors to watch, obviously substance misuse, problems with sleep and access to physical activity. If I think about some of the major issues that might help in terms of local leadership, let me just start by acknowledging some of the issues that have been flagged up to us and are very resonant in current conversations. The first is that healthcare does not fix communities. Good healthcare, however well provided and provided with the right evidence to the right people at the right time, in the right place, in the right way, is only likely to affect between 10 and 20% of good health. So there is 80 to 90% of what guides our health and our mental health and our mental well-being is outside the role of NHS healthcare services. And profit unequally shared does not heal communities. And a crisis like the COVID-19 pandemic doesn't define us, but it can though expose our strengths and weaknesses and the underlying structural, economic and social inequalities that already existed before the pandemic, but may be heightened due to the current pandemic and the underlying social reactions to that pandemic and other social issues. So when we think about building back better, this starts locally, especially at this time. I asked a number of colleagues internationally who've been working in Philadelphia, New York City, West Midlands and Stockholm, and I asked them what would they say would be the most important guiding principles for a local integrated area to start looking at prevention to improve the mental health and well-being of communities. And this, in summary, is what they responded. Frame this as a community-based approach, taking a community development and asset-based model to buttress the social and societal buffers that mitigate risks to good mental health. See the role of the NHS as one of a number of anchor institutions, as a good employer, a responsible purchaser, and aware very much of its wider impacts. That it has a role to play in supporting, particularly providing logistics and supporting community leaders and community organisations. That any high-functioning integrated system should be surveying what's happening in their communities, modelling to see what's likely to come next, testing for markers of higher levels of mental distress in their population, and deploying a mixture of social marketing messages, particularly that seek to acknowledge normal responses to traumatic events, avoid pathologizing in terms of mental illness. But given that we understand what good surveillance and modelling does, it's very incumbent that the most surveying is done with those who are at greatest risk. The other thing that they were saying was to give this a well-being frame. Local authorities have the powers of well-being, and if you adapt that well-being frame in addition to inequalities and human rights, with a greater emphasis on neighbourhood democracy, citizen panels, and the search for structural and local solutions, that would be some of the ways that they would go about pushing things forward. So keep your frame of reference about well-being, about pursuing wellness, going beyond illness to wellness, about one of equality and human rights and putting the most vulnerable first, about putting power in the hands of disenfranchised communities, about the principles that you hold dear collectively as a community, and that you're very clear about your measures of success, which are defined by your community, and that it's recovery and ongoing recovery of individuals and communities that matters most. Look to where your green shoots are. Your communities understand more about what works and what doesn't work. So make a case for change, make it strongly, make it visible, have a vision that you share and communicate, have a wide range of agencies and leaders involved, and focus on key areas of action. And as Norman said in his introductions, maybe those key areas of actions now, they were ever thus before COVID, but now have to be on lifting the lives of those most disadvantaged, of sorting the disparities in our communities, and once and for all, dealing with inequalities where we live, work and play. Thank you.
Thank you very much for that, Gregor Henderson. Gregor is the Director of Mental Health, Public Health England. Thank you so much for those powerful messages for us. I'm now going to hand over to Councillor Jack Hopkins, Leader of Lambeth Council, to say a few words.
Okay, Ranjit, thanks very much. And Gregor, Gregor has effectively stolen all of the things that I was going to say. And given that he's the public health professional and I'm supposed to be the politician, maybe we should be voting for him instead. I'm going to try and not echo some of the things that Gregor said, but to reinforce them. And I think the point that Lambeth, Southwark, Lewisham and Croydon are here as local authorities is to demonstrate that we recognise all of the things that Gregor said, that local solutions make a difference, that we've got to work in partnership, that it's all about us being together, and we can't chunk down issues like well-being and inequality and say that's your bit and that's my bit. We know that to tackle physical health, so take an issue like obesity, we need to support people and communities to live healthier lives, and there are loads of different ways in which we do that, whether that's gyms in our parks, helping people to eat better, making sure that air quality is better, and having healthier high streets. Mental well-being is exactly the same. It's about having play space, it's having access to green space, it's about not living in overcrowded conditions, it's about being paid well. And all of these things that make life well lived are things that we in local government and with our partners strive to do every day. Lambeth Council and Southwark worked with Guys and Tommies over the past year to make sure that they were the first hospital trust to pay the London living wage. Not simply because it's the right thing to do, but because we know that financial health of our residents, many of whom live in Lambeth and Southwark, who are employed by Guys and Tommies, has a material impact on their mental and physical well-being. Crucially, this is done through communities. We know that we need to make sure that this is not a clinical approach. What we're doing is how do we make sure that our communities are able to support each other, whether that's around social workers in schools, helping teachers to identify where young people who might not be able to articulate that things are going wrong, but they know that something is going wrong, making sure that we know that young people or adults and families are able to access the kind of support they need, whether that's on a low level or whether that's something a bit more serious, and that we're making sure that the environment and the context that people are living in are healthier overall. So I'm here just to say that Lambeth Council and Lambeth Council's partners, whether they be academia, business, the police, probation, as well as our communities, our voluntary sector, our faith communities, many of whom are on this call, are all working towards this agenda. And through the COVID crisis, I've had hundreds of Zoom conversations with groups of stakeholders, and mental well-being has come up in every single one of them, on an individual basis and the individual challenges that we face, but also the challenges that people are facing within their families, within their wider communities and within their neighbourhoods. And this is especially important, and I'm glad that both Norman and Gregor have mentioned it, that different communities are affected in different ways. And certainly in my part of London, as opposed to a Harrow or a Brent, my Black and African Caribbean populations have been significantly more affected, both on a personal level, but also within the community. And when I talk to residents from those communities, they know way more people through their family networks or their personal networks who've been affected, and that cumulative impact within communities is really weighing and crushing. And so we must pay attention to that, and the only way that we'll understand that is at a very local level, where people live, where people are connected. So I'm really pleased that people are here. I think this is going to be a really exciting initiative from SLAM, so I'm really pleased, and I think it's going to really open up this whole conversation that's going to cover jobs, pay, schools, families, you know, everything that there is about life. has a direct impact, and how can we make those better for people. So thanks for everyone who's here, and I look forward to the conversations for the rest of the afternoon.
Fantastic. Thank you very much for that, Councillor Jack Hoppins, leader of Lambeth Council. I'm now going to hand over to Jackie Dyer, who is Dr. Jackie Dyer, Mental Health Equalities Advisor for NHS England, to talk a little bit about advancing mental health equalities through the patient and carers race equality framework. Jackie, we are absolutely delighted to have you. Thank you.
Jackie, I think you're on mute.
I'll do this regular. It would be necessary, I think, to frame my contribution here in terms of the fact that I'm somebody with lived experience, and that I'm also the carer of siblings with lived experience. And yesterday, my brother, after 30 odd years of being a mental health service user, died. And I won't detail the circumstances, but what I would do is make this really live. And the live bit for me is that we have a significant opportunity to get this right, because many people have long-standing issues that create mental health challenges, some of which have been articulated already, which have been further exposed by COVID. This is not just a new occurrence. What this has done is reveal actually all of the kind of determinants, all of the kind of experiences that people have in an ongoing way, and made it utterly transparent. And I'm grateful for the leadership that SLAM is taking, the trust is taking in bringing and convening this for people to work together as to how to attend to this in a more robust way than previously. The major support for this from a national perspective is also the NHS England long-term plan and the Mental Health Act review, and in particular in terms of the NHS, the 5-year forward review for mental health started the conversation to embed into the NHS the commitment to advance mental health equalities. And I chair the Advancing Mental Health Equalities Task Force for England in order to drive through addressing mental health inequalities across all protected characteristics, because we cannot be deluded as regards the differential experiences that people have in relation to their mental health challenges, problems, experiences, and in fact the liberty that they have in the wider world and society, because that's what we're experiencing. And in that context, the further tool that we are creating, which was a recommendation from the Mental Health Act review, is the Patient and Carer Race Equality Framework. I'm delighted that SLAM is one of the 3 pilot sites throughout the country to take this forward. And this is specifically to attend to the racialized experience of our population. And this is an accountability framework to assist and aid organisations to develop their competencies in how they work and deliver services much more effectively and in partnership with those racialised communities. So that patient and carer race equality framework, we call it the PCREF, is the pilot sites are in Manchester, Greater Manchester, Birmingham and Solihull, and London via SLAM. And at the centre of that is a patient and carer feedback mechanism, yes, so that we can start getting feedback from racialised communities about the nature and quality of the services autonomously, so that we can really dig into quality improving the services that we provide. So the Advancing Mental Health Equalities Task Force and the PCREF together is the national direction that is being spread throughout the whole of the country. And in fact, each organisation has to have an advancing mental health strategy to demonstrate that they are taking this agenda forward and seriously. And this intertwines very well with this whole prevention agenda. When we know that when we do one size fits all, it doesn't work for one size. It works differentially for differential communities. And it's that, amongst everything else, that the COVID experience has told us that we need to attend to with honesty, with transparency, with robustness and rigor, so that we're not going forward into the next 2, 3, 5, 4 years with these kind of disparities, discriminations, and disproportionalities. It is no longer sustainable, and it is no longer the way that we can go. Thank you.
Thank you so much for that, Dr. Jackie Dyer. We're very grateful for that. Jackie Dyer is our Mental Health and Quality Advisor for NHS England and Chair for Blackfriars. Thank you very much. I'm now going to hand over to David Bradley, who is the Chief Executive of South London and the Mosley NHS Foundation Trust.
Thank you. And thank you, Jackie, for what you've just said there. What I'm not going to do is, again, as Jack said, I'm not going to repeat any of the things that Jackie has powerfully said there. But I think I'm just going to give a few messages around the importance that this is for the organisation. Both myself and Norman are relatively new to SLAM, and we are determined that we will make a difference on this. And I think it's really, really important that we acknowledge that there are real health inequalities in the provision of mental health services, particularly for people from a BAME background. And whilst it's nothing new, and there's been lots of different policy initiatives to try and change this, it hasn't really been that successful. We know that there still is a constant overrepresentation of Black, African and Caribbean people in detention. That people from a Black, African and Caribbean communities are 40% more likely than white people to come into contact with mental health services through the criminal justice system. And rather than getting a referral that other people there from GPs or talking therapies, and particularly young Black men are more likely to be detained under the Mental Health Act, and that white British adults are more likely to receive treatment for mental health problems than adults in other ethnic groups. So we have got to find a different approach to delivering this, and we need fundamental change in the way that our services are organised, and that's absolutely needed. So Jackie's talked a bit about what is called the PCREF, and I won't go into that because I think she's eloquently set that out. But I think what is important for us to say and for people to hear is that we feel that we need to be held account by a local community for delivering on the priorities and the targets. This is not about us setting things in a room and we go to our commissioners and we say, well, this is what we've done and hold us to account. We need to be held to account by local communities, because it's really important that local communities feel that we listen and we act on issues involving this. And we're determined that we'll make a difference in this aspect of mental health. It is one of the most important priorities the organisation has. And we know that there have been difficult issues in the past, and we will face difficult issues in the future. But it's not something that either Norman or myself or the rest of the leadership team at SLAM are willing to ignore, and we are committed to it changing. It's not acceptable to have this situation, and we've got to find different ways to work on this. And we cannot, someone said earlier, it's not one organisation on its own, but it's about how we work together on that. And that will mean us doing things differently and giving up some of the power that we have and transferring some of that and some services to other organisations locally. We recognise that, but we want to make that difference and work with people to be able to do that.
Thank you very much. Thank you very much for that, David Bradley, Chief Executive of South London and the Mosley NHS Foundation Trust. We're very lucky to be joined by the Right Honourable Harriet Harman QC MP, and I will shortly be passing this on to the Right Honourable MP.
Thank you. Hi there.
Hi, we have Harriet here. Harriet, I'm going to hand over to you now. Thank you.
Okay. Thank you very much, Ranjit, and Olivia and Danielle and the team for organising this enormous event, and thanks above all to Norman Lamb, the chair of SLAM, for bringing this all together. And really, as a member of Parliament for a crowded inner city area with lots of big council estates and lots of different opportunities, but lots of very big problems. What I've seen of people contacting me who've got problems is that all the people who had problems before COVID lockdown, whether it was problems of money or housing or with neighbours or within the family, all of those problems have been made worse by COVID and the lockdown. You know, if you were worried about money before, your money problems have got worse. If you were in an overcrowded flat, then it's even more intolerable to be locked indoors for so many hours. If you've got problems with noisy neighbours and you're all stuck next to each other, then that has become worse. And if there's problems within the family, with domestic violence or child abuse, obviously, then that is worse as well. And so basically, I've had 1,655 cases since the COVID lockdown of people who've come to ask for my help, and it's all those problems that were there before but made worse by it. And of those, I have to say, quite a few of them have come from South London and Maudsley workers, employees who've contacted me on behalf of your service users, and I want to thank you for helping your service users by getting in touch with me to try and help cut through red tape and get problems sorted. And obviously over this period I've been in touch with your chair and with the chief executive, and I want to also thank everybody for what they've been doing. We were concerned very much at the outset of the lack of personal protective equipment, the lack of testing, and the lack of resources. And I've said that I want to be helping tackle all of those issues. Very concerned about the safety of patients, the safety of staff, and trying to sustain services and support the system with fewer staff and greater anxiety. And I have got 3 points really I would like to add to the action plan for consideration. The first is about resources. You know, we all know that resources across councils were stretched even before the economy and services were absolutely knocked for six by this COVID. We all know that particularly the mental health services within the NHS have been underfunded, and we know that there's going to be an increase in demand afterwards. Of the point that Gregor made, people who've not been able to get treatment, or people who've delayed seeking help because of COVID, and people not getting the help they need. So we know there's going to be an increase in demand. And what we cannot see at the end of this crisis is we cannot have a return to business as usual, or even worse, the government deciding that they are going to balance the books and return to austerity to pay back what they've borrowed to deal with this crisis. So I think we must have quite explicitly in the action plan that as the 4 boroughs and SLAM and all the MPs to work together to absolutely explain to the government how much resources are going to be needed and seek a commitment that those resources are given. The Prime Minister said in dealing with this crisis, it would be whatever it takes. Well, we have to tell him what the money is that it will take and insist that he comes good with that. The second is the issue about employment. You know, we all know that it helps recovery for people with mental health problems if they can be in meaningful work. It's important for people who are managing mental ill health that they're working. It helps them obviously financially, but it also helps with self-esteem. So we know how important it is. But we know that in relation to people with mental health problems, that there is a lack of flexibility for them at work, and often there's downright discrimination. Now, Southwark Borough as a council, and I really pay tribute to Peter John and all the council employees and other councillors on this, have made huge efforts to support local businesses and to support councils, to support businesses during the COVID crisis. And I'm sure Croydon, Lambeth and Lewisham have done the same. But I really have concerns about what's going to happen by the end of July, when the furloughed, I think a lot of furloughed workers are going to be likely to be made redundant, because employers at that point will have to start contributing. I think there are many self-employed people who are going to be running out of money, and their work and activity is going to disappear. And councils are absolutely key to actually ensuring that the economy locally gets back on its feet. I'm really worried about what the employment prospects will be for people who are at the front of the queue of the labour market, let alone those with mental health problems. So I think what we need is a specific national fund for support in employment for people with mental health problems that needs to see extra funding going for this for councils, extra funding for the voluntary sector, for colleges, for businesses, so that we have a bespoke stream of work which says we know people with mental health problems are going to have difficulty in the post-COVID economy. We are going to help them. We are not just going to let them struggle and be at the back of the queue. And finally, and this is so that's the second action point. The third one is about the BAME community. You know, we've seen the explosion of anger at the murder of George Floyd in the States, and that's an anger about police brutality, but it's also about injustice and inequality and discrimination and oppression. And, you know, we have injustice and discrimination and inequality and oppression in this country too. And we've seen that COVID has had a disproportionate impact on the BAME community, because it's exacerbated, as Jackie said, those inequalities. So I think we owe it to those who we've clapped on so many Thursdays, and we owe it to our BAME communities that we have a very specific action point, that we do our bit to celebrate the BAME community, to celebrate immigrants and what they do here in our communities, and to recognise and stamp out inequality and discrimination. But more than committing to do our bit, that we've got to demand that the government do their bit too, because it's very difficult to do that if you get the drumbeat of anti-immigration that is promulgated by the government. So we need an explicit action point, I would say, on that. And I'm really just so delighted to have been invited to be part of this event. And I really feel it's very, very promising. I feel energised at the prospect of working with you all to get those three action points, and no doubt the many others, important ones that other people are going to bring forward.
Thank you very much. That was the Right Honourable Harriet Harman, QC MP, and I'll hand back over to Ranjit now. Thank you, Ranjit.
Thank you very much for that, Right Honourable Harriet Harman, QC MP. Thank you very much. I'm now going to hand over to Peter John, who's the leader of Southwark Council, to say some words on working together to tackle the impact of COVID-19. Thank you, Peter.
Thanks very much indeed, Ranjit. And I want to echo everything really that Harriet said in her comments. At Southwark, since 2018, we have sought to prioritise work on mental health, good health, above all else, and it's been at the heart of our council plan. 3 particular commitments: protecting adult mental health services in our borough, delivering a loneliness strategy, and protecting funding and improving access to mental health services for children and young people. I just want to talk about that for a moment, if I might, because at the end of 2018 we became the first council to make a commitment to work with our partners, including SLAM, CCG, schools, voluntary sector, to ensure that 100% of children and young people got the support with their mental health needs that they needed. And I'm pleased to say that despite the challenges of COVID-19, that work has continued. And in April this year, we opened The Nest, which is a hub for 13 to 25-year-olds to use and come and I suppose raise their concerns about their mental health in a supportive environment. Physically, it will be located on Rye Lane once this crisis is over and it can reopen, but it opened on a virtual basis in April. We've carried on working with adults as well, but I want to talk about children and young people because I think there is a risk, as Harriet was alluding to, I think in her comments, that there is a generation who will be impacted by this, who will see no hope for their lives in terms of employment, in terms of training, in terms of the skills that they need. And we have to be there to support them. As a council, we'll be there to support them, trying to create those job opportunities and the skills and training that they need. But for those who do feel despair or concern, that we support their mental health as well. And so projects such as the Nest will be our response to that. We know that there are many young people who are concerned about their exams. They won't be taking exams, but they don't know what their results will be. They're concerned about where they'll go on in education and training. And that really is having an impact. And we've seen through both the Nest and Couth, which is another online place for Southwark young people to come, that those are the issues that are concerning them most, together with a general anxiety. And so I suppose the work that is being proposed today, the commitment today from SLAM and the work that Norman, you and the team are leading here is massively welcome. It reflects the priorities that we have in Southwark, and I know that fellow leaders share it right across our part of South East London. And I do hope that today will be a launch pad to send out a very clear message to that generation of young people who are impacted by COVID-19 at this time, that they're not forgotten, that they'll be supported in all sorts of ways. But most importantly, for the purposes of the day, their mental health will be supported by all of us, working together right across the system in every way that we can. We'll find the resources. We have put £2 million more in Southwark since 2018, and it will be incredibly tough. But for me, this is going to be a clear priority, and we're going to have to make sure that it continues to be a financial and work priority for all of us going forward. Thanks.
Thank you very much for that, Peter, and much appreciated. Peter is the leader of Southwark Council. Thank you very much. Thank you very much, everybody, and it gives me a great pleasure to introduce Dr. Lade Smith, Clinical Director at South London and the Maudsley NHS Foundation Trust, along with Councillor Janet Campbell, Croydon Council, who will give us a delegate's point of view update. And I'm going to hand over now to Dr. Lade.
Hi, so I'm just going to talk a little bit about the first session or so with Gregor Henderson. And I was really impressed, actually. I'm really, I was struck by the fact that here's someone who's working nationally in public health. And I was very pleased to hear that Public Health are actually, Public Health England are surveilling what's been going on. They're monitoring the rates of, the rates of COVID, what's happening, who is experiencing the adverse effects. And the evidence is, as we've all heard, that if you are from a Black, Asian or minority ethnic background, or if you are from a disadvantaged background in any way, you are going to have much worse outcomes. And for many of us, we knew this already. COVID has just highlighted that. But what I was really pleased about was that he highlighted some of the initiatives that might help going forward. And we know that post-COVID there is going to be a recession, and that's going to have an undue and disproportionate impact on disadvantaged groups, particularly BAME groups. And that means that there has to be social protection policies. There have to be decisions made at a higher level to change the structure about the way in which we provide support and care to people. And that without doing that, without providing support and care to our most vulnerable groups, then they'll always have a problem. And not only that, I mean, my view is, and maybe that's why I thought it was great, my view is that if you can make things better for the most vulnerable in your society, then things will be better for everybody else. Because if you can get it right for the most vulnerable, then it will fall into, because everybody else can to some extent look after themselves, or things will improve for everyone else anyway. In terms of organisations, I thought it was also very positive that he pointed out that large organisations like the NHS and you know, education, etc., can only do so much, and our role is not to take over. And we've been hearing a lot about communities in the session that we had in our breakout session. The role is actually to support communities to be able to develop resilience, to be able to provide, organise the needs and provide the support for themselves. And as SLAM is part of the community, and I would regard it, SLAM should be regarded as a community asset, not something that sits outside the community, but part of the community. And it made me feel that it's incumbent upon us in SLAM to make sure that we actively engage the community so that we can find out what the community need from us and how the community can best use us to support them. And that's not about SLAM telling the community what to do, it's about the community telling us what they need from us. And in that way, we can help to support the well-being of the community, to pursue that well-being, and to ensure that there will be better recovery of the community via ensuring that we understand the needs of the community. And I think also really, you know, Harriet Harman's points about resources. We always need more resources, but it's not enough just to throw money at the problem. We have to do it differently, and we have to ask different questions. Employment is key. We do need to have a different way of ensuring that people have meaningful employment. And I think, and specific national fund to support those with mental health problems is excellent. And finally, of course, people from BAME backgrounds suffer in inequality, inequity, and injustice through discrimination and oppression, and that has to change. And we heard from in our session about some things that will help make a difference. And again, it goes back to actively seeking out the community, working using something like the PCREF framework and the advancing mental health equality approach, and that we have to have explicit actions around for each organisation. Specific points: what do your local population need, and what is it you will do to support them to support them with those needs? And that includes helping develop the local population so that they're able to complain, so that they're able to get what I always talk about, the Dulwich mum. Someone who is in our population, everyone in our population should be able to complain as vociferously as well as your average Dulwich educated mum, who can get what they need for themselves and their families. And that's what I would like for every single one of our patients. And not just our patients, but everyone else who lives in our community as well.
Thank you very much, Dr. Lotto. Really appreciate that. I'm going to hand over to Councillor Janet Campbell, who's just going to give us a quick roundup of some of the feedback that we're having through the Q&A. Janet, I'm just going to ask you to switch your camera on if I can. Yeah, wonderful.
Hi, hello everybody, and I really want to thank you again for this discussion. It's been so powerful, and so much has been learnt. Employment services across all the boroughs should be working collaboratively to share best practice for supporting those who are unemployed and those who work in retention, who are struggling with mental health as a result of COVID-19. Creating employment, peer support forums, vocational workshops, a mapping exercise would prove valuable in allowing services effectively meeting the needs of their clients and making appropriate referrals. Beverly Wong in our session, she was very powerful, and I really want to just take a moment to just talk about what she spoke about. She talked about the community coming together. She talked about parent power, which I believe is the page that we should be on, you know, about divulging power to the community and deploying staff amongst the community also. She talked about the group calling others weekly, and vulnerable families, having to support them in ways that she's never done before. Lade talked about the fact that what we need to move on to will be easy. It seems difficult, but actually it's just a decision, and it's a case of including people in that conversation, the right people in that conversation. Thank you.
Thank you very much for that, Councillor Janet Campbell. Very much appreciated for giving us the feedback on that. I'm now going to hand over to our leaders of the council and to Councillor Chris Best, who's the Deputy Mayor of Lewisham, who will take us through a summary feedback from all of the breakout sessions. Over to you, Councillor.
Oh, thank you very much, Ranjit. I think it's been so interesting hearing those different points of view, and certainly in our session we had some excellent questions from our delegates. But I'm going to start by going to Jack from Lambeth for feedback from his session.
Thanks very much, Chris. We were talking about the effects for children and young people, and we had some absolutely knockout questions, and we probably could have been there for 2 hours and it would have been fascinating. And we talked about the need to co-produce and collaborate, joining up the system at the front line and youth workers and schools and all the other sorts of things, and how do you do commissioning and that sort of stuff. But I think the most powerful thing for me was Ezra and Sophia, who were two young women from South London who told incredibly powerful stories of their personal experience during COVID. And of course, what struck me was that they were so normal stories, and I'm obviously not a young person anymore, but I could relate to a lot of this. And I suppose what we then talked about was the lack of stress relief that probably everyone who's on this call can relate to, but that actually the pressures for young people being constrained and not having access to your friends, not having access to a support network and teachers in a way that we might be freer to do so despite lockdown and COVID. That lack of milestones in your life, like graduating school or doing your exams or people's birthday parties. And we got down to a very fundamental question, which was how do we talk to each other? How do we listen to each other on a very human level? And there's a basic level of humanity that we need to kind of refocus on. And for me, as a leader of a council and someone who worked in local government for 10 years prior to that, it's not about services, and it's not about directorates, and it's not about organisations. It's about the fundamentals of what do people need, and how do we make sure that they're supported in a very human way and in an emotional way. So I was uplifted by it. I think we've got an opportunity to reshape the world as we want it. I hear through this whole COVID crisis a lot of conversations about how the world should be, and that's all well and good. But the world that we will have is the world that could be, and we've got to do something about it. And only by making sure that young people are able to shape decisions and to deliver them, and us to do that with them, is going to happen. There's no point us doing a consultation with a bunch of young people and then taking that away. We've got to put young people in the driving seat, and that was the abiding thing that came out of the conversation from me, that we can't be bound by our organisations. We've got to be focused on our young people. Thanks, Chris.
Well, thanks very much, Jack. Can I go to Peter next, please?
Thanks, Chris. Our group was looking at community resilience, and we heard from the amazing Josephine and Laura, and Josephine was talking about PACT, which is an organisation well known to me, Parents and Children Together. And I suppose all of the contributions from London citizens and from Josephine and Laura, from health professionals, and indeed from me, were looking at, you know, what are going to be the big challenges that face us coming out of COVID-19? What are people's fears going to be, and how can we bring our communities together, give them the strength that they will need, not so that, you know, the first port of call is SLAM and mental health services, but actually it's that prevention, the whole purpose of this conference. And I think that a lot of the emphasis of the conversation that we had and the contributions in our group was about those community organisations which have worked so magnificently up to before this crisis, supporting people, and how their value will be so important going forward. And my contribution was in terms of seeing councils as enablers, you know, and celebrating our communities. A point I made, and Norman endorsed it, was, you know, we have to be able to give our communities confidence at this time. It's going to be one of the biggest challenges. Confident that London and Southwark and this part of South East London is the right place for them to live and to be. Confidence that their employment prospects will be better, and confidence that their communities will continue to support them in the way that we have seen communities supporting each other over the last 3 months. So I think that was the message out of our group, Chris: confidence in our communities, the role of councillors helping to support that, and being cheerleaders in chief for the work that will go on now.
Thank you very much, Peter, and I know other councillors on the line will endorse taking that away, that we really must get out there and, as you say, be cheerleaders. So thank you. Turning to Tony, we've seen you on the screen for the afternoon, Tony, so would you like to contribute, please?
Yeah, thank you very much, and can I just add my thanks to Norman and the team for making this event happen. It's hugely powerful, and the clue is in the name, prevention. I've heard a lot of people in the run-up to this, and some of the conversation today saying we can't go back. Well, I don't want to go back, because back wasn't good enough. Back wasn't where we want to be. I spent too much time speaking to young people, you know, some of the worst cases, and I'm sure you've all heard them, who've wandered into our knee units feeling suicidal and been told to come back in 6 weeks' time. This is about prevention. This is about intervention. And to Harriet's point, and as a council leader, it would be remiss not to make this point. You know, our budgets have been hit, as you all know, by up to 70% over the last 10 years. We heard words from the government around we'll fund whatever it takes. At the moment, we're not being funded for whatever it takes. And that funding matters when you start to lose mental health support in schools, when you can't roll out everything you want in terms of services. But just briefly to talk about Croydon, we're not going to let that stop us. So we are, as very much I've heard a theme today as well, we're taking our services, our frontline services, further into the heart of our local communities, bringing service provision together. Mental health prevention's got to have a greater role in that. I think if I look at my own borough, we've got a lot of strength in terms of the close partnership working with NHS and others. But I think this event today signals an upping of the game that we've all got to respond to. I think from SLAM, and I applaud you for that. I think the workshops have been incredibly useful. I know we'll get the feedback from them. But empowering our communities, ensuring we've got the funding to support the actions we need. Yes, as councillors, the Croydon Council, probably only Croydon Council, the business community, could have built with no funding around a legacy youth zone supporting 5,000 young people in the borough in the last year. We know we've got a role to do with some of the big infrastructure pieces, but we've also got to make sure as councillors, I think as you just said, we've got to get out there, we've got to be on the front line, we've got to make sure that those providing the services that need them most are there alongside them to provide them. I think today's been a hugely, on a practical level, constructive event, and I hope it sent a huge signal about how across South London we're not going back. We're going to go forward, whatever the pressure's on us, and offer a different support to everybody that needs it in these times we face. And off the back of the public health report today, you know, that shines a further light on the inequalities of COVID, then I think this is an even better timed event than it might have looked in the first place. So thank you for allowing me to say a few words. Thank you to my colleague Janet for our mental health champion and cabinet deputy for heading that workshop up, and look forward to the next event, hopefully soon.
Thank you, Tony. I'm just coming back to the BAME feedback. Did you say, Rajit, that Dr. Smith is giving that?
So can you?
It's the last feedback. I'm doing employment, and we just want to hear from our BAME community workshop.
That's a good point. Actually, can I ask David Bradley to just give us a few words, if I may, to just summarise a little bit about that workshop. David, I'm just going to hand over to yourself. So two seconds, just to summarise a little bit about the workshop that took place.
Okay. Thank you, Ranjit. So I'll be very quick. There was a lot of, we heard a really powerful story from a lady who'd been using services. We've heard some really strong stories about what it's been like in lockdown. And most of the discussion that we had took part about, again, what people have just been saying about not going back to some of the things that we had before, and about how we've got this chance to change things. But this cannot be that it is just the statutory services that are doing this. This is about communities, it's about voluntary sector groups, and it's about us giving responsibility, ceding over some power and resources to others to be able to do things in a more culturally appropriate way. You know, there were, we talked about how there are different groups across the boroughs that are able to do this. Natalie talked about the role that in terms of Black Thrive and how this has been helpful in pushing things forward. But I think the overwhelming sense was about that COVID has shown the disadvantages and the inequalities, and what we cannot let this, we already knew there were inequalities beforehand. If it's kind of a double whammy and we don't change things as a result of it, we'll go even further back than what we were. So they were some of the key things, Ranjit, I think that we spoke about.
Oh, thank you very much. I'll just finish off then on the employment one, which I was a part of, and there were just a few key points, conscious of time. The first one was very much thinking about SLAM and the NHS service in recovery, and really the help that SLAM could do in partnerships, in volunteering, in apprenticeship, and working with the 4 boroughs. So we think there are some opportunities there. There were some great examples of where work's gone on in London Living Wage, in working through that accreditation, of really rewarding people, because as we've heard earlier this afternoon, it's about self-esteem, it's about valuing work and getting people back into employment, but sustainably, and making sure there are training opportunities. We talked a little bit about social enterprises and the support that could be given to that, and there was a great example of an organisation called Recover in Lambeth, which does decorating. So again, bringing people in, but nurturing, ready then to go on to sustain the work following training. We talked about opportunities in the caring profession. Proud to Care has really been emblazoned across London. I would say Lewisham, in fact, had the greatest take-up for my colleagues, but just by the by. But it's great to get more people into the caring profession, and to make sure that then there's a proper reward system, that it really is recognised as the profession we know it is, but to make sure there's accreditation, and there then can be progression through a career in caring. We also talked about the local recognition, that it will be different, as I think that's been a bit of a theme for the afternoon. And when people do return to employment, we need that collaboration. So with Job Centre Plus, we had an interesting question about how we can work together, that there is ample time given for someone who's been in lockdown, you know, who just may need that extra support that you were talking about earlier, Norman. It can knock you, and you need to regain that confidence, partly what Peter's been saying. So I think employment coming out of it's going to be key, and there will be opportunities. There will be, sadly, empty shops in high streets where they could be used as pop-up shops. They could be used for all sorts, to bring the community together, to keep all that work in community hubs going, you know, and to really keep the communities engaged, because that has been such a success through this, you know, long 12 weeks. I think when you're in lockdown, it just feels a bit longer. So I think there were quite a lot of points from that group, and no doubt we'll hear it. And just handing back to you, Norman, I just again want to really thank you, because this has been such an interesting and a powerful afternoon. Some stunning speakers. So, and also I want to thank the experts who've shared their stories, because I think for each of those breakout sessions there were some moving comments made. I think we've explored a number of themes today. I think what's key is we can do so much more together, that if we work collaboratively, working with the 4 boroughs and all our partners who've been on this call, particularly the third sector, we can get there. We can deliver more than we've had. And I just think it's so important to continue what we've developed this afternoon. So we've had a lot of input and support from all the delegates. So shaping that plan going forward, I know, you said at the top, it's really passionate to you. So I want to start working with you, as I know my colleagues do, for those urgent actions, get them into place. And as I say, we've just been amazed by you leading this. You've really pushed it on as a summit. So over to you to start that effective collaboration and the action plan. Thank you.
Thank you very much for that, Councillor Chris Best, who's the Deputy Mayor of Lewisham, for facilitating the session. I'm going to hand back over to Sir Norman Lamb, Chair of Southland and the Mosley NHS Foundation Trust, to talk about the next steps and commitment from our partner organisations. Over to yourself, Norman.
Well, thank you, Ranjit. Thanks also to Chris for your very kind words. It's appreciated. And I should just say right at the start that it's been an immense pleasure to work with all of the council leaders, Jack, Tony, Chris, Peter, but also Janet has been brilliant, and Jackie as well, who spoke so powerfully. And just let's remember that Jackie chose to speak just a day after her brother had died. So sincere condolences to you, Jackie, and we appreciate your participation. Thank you. I think this is probably the first event of its kind across the country. And I think we should all be immensely proud together for what we've achieved here, what we've pulled off. It's been staggeringly scary at times, but Ranjit and his team in comms, but also the technical team, have pulled off a bit of a miracle here, I think, and it's been so powerful to bring so many people together. Rich conversation, but also I think a real statement of intent. That's what I think is so exciting. I was struck by the comments about how we need to celebrate our communities, to be very positive about so much that our communities have to offer. The comments about enabling people and communities to be of their very best. That was, I think, so powerful as well. I was struck by the points that Harriet Harman made, and resourcing is absolutely critical to this, and it must, I think, be part of the work of the task force going forward. And she made really important points that were reflected by others about employment. Has to be at the heart of this, but also a recognition of injustice that exists in our communities, disadvantage, and the sense that disadvantage is heaped on disadvantage, and we have to confront that. And this, it seems to me, is the most constructive way, actually demonstrating by working together that we aim to confront those unacceptable disadvantages that persist in our communities. That is the best way of demonstrating to people how we can make a difference. So, and just finally, before I move on to the steps going forward, I thought Ladi put it so well when she said that SLAM should be a community asset, not lording it over people, but being a resource for others to collaborate with to make the best for our community. So, Ranjit, can I now ask you to put up the slide which shows the actions that we've been talking about today, but also agreeing with our council leaders. And I think this is a very good framework within which we can move forward. So the 6 actions that I suggest that we agree today as the basis for this year of collaboration, and I want this not to be just a year, I want this to be the start. First of all, to create a mental health prevention task force. that will have representatives from across organisations, statutory and community, and across boroughs, that will oversee a 12-month prevention programme. Secondly, to develop a programme of mental health community capacity building across South London, which will work with schools, with faith and community groups to stay well, make sure that we reach out and listen to as many communities as possible across our 4 boroughs, including those for whom English is not the first language, to help shape this work, to create a package of digital mental well-being courses for all residents across South London through the South London and Maudsley NHS Foundation Trust Recovery College. They do great work already, but we can reach more people. Fourth, to support and share the South London Free Your Mind mental health campaign with all residents and communities. Now, the Free Your Mind campaign is an initiative from NHS South East London, CCG, and it's been looking at ways to ensure that the people of South London are made aware of mental health support during the current period of the pandemic and beyond. And it's looking at how we can establish how to help people access existing support that may already be out there, that can help people to get through these difficult times. Fifth, to work together on tracking the levels of psychological distress in our communities as a result of COVID-19. And sixth, to host a mental health prevention follow-up summit in October to report back on progress and further challenges as a result of COVID-19. Using the priorities that we've shared today and from our listening campaign with local communities, we'll publish our shared action and implementation plan in full at that October summit. Now, I just think that gives us a fantastic framework within which we can work together. And what I want to see now is momentum building so that we grasp this and make it real for the communities that we serve. But I think that this is a big opportunity to make a difference for local people, and it's an opportunity that we must grasp. Thank you all very much indeed.
Thank you very much for that, Norman, and thank you very much to all our speakers. We are coming to the end of our first Urgent Mental Health Prevention Summit, and we're very grateful to everybody who's taken part, to all the delegates that have attended and taken time out to be able to make this event possible, and especially to those experts by experience that shared their stories so passionately in the breakout sessions. And you will hear more about what the next steps are going to be in the coming days. For everybody who's registered, over 1,000 people who've taken part in the summit today, we will be posting out further details and a survey that will be circulated out next week to share and capture your views. So please do keep an eye out for that. And as was discussed at the very start of the summit, we will be holding a broadcast event on a particular theme every month that will go into much more detail on this. So we hope that you will remain and join us for those events. And it leaves to me to bring to a close the Urgent Mental Health Prevention Summit, and just to ask you all, wherever you are, in your living rooms, in your offices, on your kitchen table, just to give a virtual round of applause like we would do in a real life summit.